Hello, thanks for the opportunity to talk to you about our proposal. My name is Gustavo Almeida, and I'm a research assistant professor from the Department of Physical Therapy at the University of Pittsburgh. I'm a junior investigator with interest in identifying factors that prevent individuals with musculoskeletal disorders from engaging in physical activity, so I can develop tailored interventions to increase activity participation in these individuals. So with that career goal in mind, I'm proposing a secondary data analysis to investigate the associations between physical activity and markers of inflammation in individuals with rheumatoid arthritis. Rheumatoid arthritis is a systemic and autoimmune disease where pro-inflammatory cytokines are elevated. One of the main characteristics of this disease is severe inflammation of the joint. This joint inflammation causes pain and stiffness that lead to functional limitations that restrict the individual's ability to perform daily activities, which in turn worsen their health status and drastically reduce their health-related quality of life. Usually, to treat the RA symptoms, physicians prescribe medication, right? And often they neglect promoting activity participation due to their concerns with aggravating the symptoms. That in turn feeds into the downward spiral towards physical inactivity and further disability and the development of other chronic diseases. An alternative treatment that has been suggested to regulate inflammation in other populations, such as obesity and osteoarthritis, is physical activity participation. However, it is not known whether physical activity affects the inflammatory process in RA. Therefore, assessing the relationship between physical activity and inflammation in RA would be an important step to recognize whether physical activity participation is a safe intervention. Furthermore, examining how patient characteristics such as younger versus older age and male versus female will affect this relationship may help identify the appropriate subgroup of individuals with RA who may benefit from physical activity promotion. Therefore, the specific aims of our study are: 1. To determine the associations between physical activity and inflammatory biomarkers in individuals with RA, and to explore for potential moderators of this relationship. We hypothesize that physical activity will be negatively associated with inflammatory biomarkers, and also that associations will change as a function of subjects' baseline characteristics such as age, gender, body mass, use of pain medication, and presence of comorbidities. Our second aim is to explore the associations between changes in physical activity and changes in concentration of inflammatory biomarkers in individuals with RA who underwent exercise intervention to improve function. We hypothesize that changes in physical activity will be associated with changes in concentration of inflammatory biomarkers. Our third aim is to explore whether changes in concentration of inflammatory biomarkers imparted by changes in physical activity participation are mediated by changes in individual characteristics. For this, we hypothesize that associations will be mediated by changes in subjects' characteristics such as disease activity, pain severity, disability status, and body mass. The proposed study combines a highly qualified multidisciplinary team of researchers from the University of Pittsburgh and UPMC with a history of collaboration and significant expertise with the proposed study methods to assure completion in a timely manner. The proposed study will use baseline and follow-up data such as demographics, physical activity, blood samples, disease activity, and disability from a randomized trial that compared exercise interventions in individuals with RA. The blood analysis will be done in 2 laboratories located at UPMC that our team has experience with. Baseline data will be used to examine the associations between physical activity and inflammatory biomarkers, and to explore potential moderators of this relationship using subjects' characteristics. And the longitudinal data will be used to explore the associations between changes in physical activity and changes in concentration of inflammation. Changes in subject characteristics that occurred pre to post intervention will be used to test for potential mediators in the later analysis. We believe that this is the first study to investigate the relationship between physical activity and inflammation in individuals with RA. If our findings indicate that physical activity is negatively associated with inflammation and that individual characteristics affect the relationship, we'll provide evidence that physical activity promotion should be used as a supplement to medication during the course of care of individuals with RA, and also to indicate who are the individuals who may benefit from this approach. Our findings will serve as a pilot work to seek for funding to develop tailored interventions to promote physical activity in this population. Moreover, having the data in subjects with RA already collected indicates that the current study is feasible and makes this an ideal opportunity to address highly relevant questions at reduced costs. I'd like to take the opportunity to thank you guys for your time and also for the opportunity.